Worksheet. How to recognize when you are triggered. Step 1. Understanding triggers. A trigger is an event, situation, or interaction that causes an intense emotional or physical reaction. Recognizing when you are triggered is the first step to managing and healing. Step 2. Recognizing emotional triggers. 1. Notice sudden emotional shifts. When you're triggered, your emotions may feel overwhelming, out of proportion, or difficult to control. Common emotional signs of being triggered: sudden anger or frustration, feeling sad or hopeless out of nowhere, feeling anxious, panicked, or unsafe, overwhelming guilt or shame. Reflection. Think of a recent time when you felt a sudden emotional shift. What were you feeling? 2. Pay attention to physical reactions. Triggers often cause noticeable changes in your body. Common physical signs of being triggered: racing heart or tight chest, sweating or feeling hot, shaking or trembling, feeling frozen or numb, stomach discomfort or nausea. Reflection. Describe any physical sensations you notice when you're upset or overwhelmed. 3. Watch for changes in thinking patterns. When triggered, your thoughts may become negative, racing, or irrational. Common thought patterns: I'm not good enough. I need to get out of here. They're doing this on purpose. I can't trust anyone. Reflection. What kinds of thoughts do you notice when you feel triggered? 4. Observe behavioral changes. Triggers can affect how you act, often leading to automatic or reactive behaviors. Common behaviors: snapping at others or withdrawing, avoiding situations or shutting down, crying or feeling unable to focus, turning to unhealthy coping mechanisms, e.g., overeating, drinking, etc. Reflection. Write down how your behavior changes when you feel upset or overwhelmed. Step 3. Identifying trigger patterns. 1. Reflect on your environment. Triggers can be linked to certain places, sounds, smells, or situations. Question. Are there specific environments that make you feel on edge or unsafe? 2. Reflect on relationships. Interactions with people can often spark triggers. Question. Are there specific people or types of conversations that upset you? 3. Reflect on your past experiences. Triggers are often tied to unresolved pain or trauma. Question. Have you noticed a connection between past events and what triggers you now? Step 4. Creating awareness. 1. Recognize patterns. Write down a recent situation where you felt triggered. What happened? How did you feel? How did you react? 2. Track your triggers. Use this simple log to track when you notice a trigger. Step 5. Checking in with yourself. Use these questions to notice when you might be triggered. Do I feel sudden or overwhelming emotions? Is my body reacting, e.g., heart racing, shaking, tightness? Am I having repetitive, negative thoughts? Am I acting out of character or reacting strongly? Write a reminder to yourself. When I feel triggered, I will pause and ask myself, what is happening inside me right now? Recognizing triggers is a powerful step toward healing. By noticing your emotions, body, and thoughts, you can better manage your reactions and take care of yourself.